Okay, here's the EKG 12 pack for session 6. In the cardiology lab, we like you to work independently to start with and then review the answer on that video screencast. Don't go through all of these without at least watching an answer or two. Then if you're having issues, collaborate with your team members. If that isn't going to work, then get a coach and we will help you. The standard is 60 seconds per EKG, and we're not even doing the full thing. We're only doing RPM A and B. And so the 60-second mark should be definitely achievable by this session. RPM ABC, we're looking for rate and regularity initially, and that's pretty quick on these because we're not really analyzing the rate. We're just acknowledging it, just identifying it. Then you ask, is there a P wave for every QRS, QRS for every P? You're looking for skipped beats or extra beats. Then your measurement parameters are pretty simple, the range on PRI. QRS less than 120. If that QRS is more than 120, then you need to deal with some axis and bundle branch stuff. And then don't forget the QTC of less than 450. On axis, we're making it simple because we're only looking for a left anterior fascicular block, which means pathological left axis deviation, which shows up as an upright or mostly upright QRS in 1, a mostly downward QRS in lead 2 and lead 3, and then a downward in AVF. And then the bundle branch block, we're looking for the right bundle because we're trying to find the bifascicular block. We're trying to find the combination of left anterior fascicular block and right bundle branch block. And so we're looking for that mostly upward on the right part of the QRS. Use your turn signal stuff on that. I put the C for changes in there, although we're not quite there yet. Okay, here's EKG number 1. And in this case, what we see is a very regular rhythm at a rate of 75. The PRI is not measurable. The QRS is less than 120, although just barely. And the QTC is just a hair over the limit. But what you notice mostly when you do is there a P for every QRS, QRS for every P, is the pacer spike. The pacer spike. And they're visible more in some leads than in others. You should always look in all leads for pacer spikes. There's a very clear one out there in V5 and V6. This is a pacemaker-driven P wave, and so further analysis pretty much comes to a halt. Number 2, we start with rate. It's 82. We look for, is there a P for every QRS and a QRS for every P, and I don't even see any P waves. And a trick that I use is to look and see if the machine saw any, and it shows the PR interval of 0, which means it can't even measure P waves. And so when you look at this, there is an irregularity, and there's no pattern to that irregularity. So irregularly irregular with the absence of P waves, atrial fib. And then we're looking for QRS, that's okay. QTC, that's okay. So there isn't any reason to do A and B on this. So we have an atrial fib with a pretty controlled rate. On number 3, rate of 117, which may be concerning in the unstable heart. Is there a P for every QRS and a QRS for every P? Well, there are clearly extra beats. There's one. There's one. There's 2 or 3 over here. And so we do not have P for every QRS. There are some QRSs without Ps. I believe those are extra beats, PVCs most likely. And so then we start looking at measurements. The PRI is okay. The QRS is okay. The QTC is okay. And because that QRS is less than 120, we don't need to worry with axis and bundle branch. EKG number 4, rate is 72. Is there a P for every QRS? Looking across here. And on this, a bunch of garbage over here. On the field 12 leads, you don't get the rhythm strip like you do in the hospital once you have to make your own rhythm strip. And so other than this artifact area, there are Ps for every QRS. There are no dropped beats or any extra beats. The intervals are fine, and so that's all there is for for EKG number 4. No reason to do A and B. Okay, on EKG number 5, we've got a rate of 53, again a little bit below the norm. Do we have a P for every QRS and a QRS for every P? These are not the biggest P waves ever, but they are discernible, and there's no extra beats or drop beats. It's a very normal, regular rhythm. Now the PRI is okay, the QRS is less than 120, no reason to do A and B, and the QTC is under the limit. So number 5 is pretty straightforward. EKG number 6, the rate of 81. Is there a P for every QRS? Certainly is a lot of stuff here. I would say that is a PVC. And that is a PVC. So there are extra beats, but when we have a normal beat, it looks like there's a P wave for each of those. For the most part, there's an extra beat from a different focus. Well, potentially not a different focus because it changed leads. So at any rate, there are premature complexes. When we come up here and we look, the PRI is over the limit, thus the first degree AV block that's marked up there. The QRS is more than 120, so we've got to do this axis bundle branch block thing. And so we look for axis. Is it upright in 1, down in 2, down in 3, down in AVF? So we do have left anterior fascicular block, which the machine reads as well. But we do not have a right bundle. That is a left bundle pattern. So we do not have a bifascicular block, but we do have a clearly identified pathological left axis. Number 7, the rate just over 100. Is there a P for every QRS? Certainly looks like it. At first glance, I was concerned that there might be extra P's, but no, that's just the T wave. But that is kind of, that T wave is pretty close to the next P. And when you look up here at QTC, that confirms it. That's quite a long QTC. And so we have a prolonged QTC, a risk for torsades potentially, and but there is a P for every QRS and a QRS for every P. So then we move on to the QRS duration. It is more than 120. That is clearly a right bundle branch pattern. And so now I need to look forward, and yes, we do have. We have up in 1. I would call that down in 2, only, but just by a hair, and down in AVF. So we do have left axis, we do have right bundle, and this is the bifascicular block that we've been looking for. Number 8, rate of 65. Is there a P for every QRS? Well, this is certainly a junky EKG, and so I think if I got this, I would run another one and try to identify, but I'm just not necessarily seeing P waves. I would also want a rhythm strip to see if this is irregular, and it may be just a hair, but there's not much of an irregular pattern to its irregularity. The machine can't read any P waves either. There's no extra beats. But that may be atrial fib underneath all that. At any rate, QRS is okay, and the QTC is okay. So other than the possibility of atrial fib, it's a relatively normal EKG. Number 9, the rate is 94. There are some P waves, although there's quite a lot of interference, and this whole lead up here is very full of interference. Again, I would run another 12 lead if I got this kind of a thing. You've got some baseline wandering, which just adds to the confusion here a little bit, and this is what happens in the field sometimes. Your patient's breathing rapidly or has a lot of tremor, or there's something else going on. But when you look here, those look like pacer spikes, and I'll admit to cheating and looking up here at the interpretation. The machine said it was a paced rhythm as well. QRS is pretty narrow. Usually in a paced rhythm you'll see some wider QRSs than that. QTC is pretty long. And so this is really a paced rhythm. There's not a heck of a lot else we can really say about it. All right, in this case we have a rate of 124. That's an interesting number. Excuse me. Is there a P for every QRS? I don't see any P's at all. I see junky baseline. I can almost talk myself into a P wave there, but they just really aren't. So, and then again, I'm gonna peek up here, and the machine can't find any P waves either for duration or for the PR. So that's looking like atrial fib. QRS is okay, QTC is okay. Don't need to do axis and bundle branch because that QRS is less than 120. Number 11, rate of 118, so outside the range for normal, but may not be problematic. Is there a P for every QRS? Well, this becomes a little interesting to identify, so I go up to my favorite P wave lead, a V1, and those just are not very easily discernible P waves. But as you look across here, it's very regular. There's not an irregular pattern. I would run another 12 lead on this and try to get a little bit better look. But I think what I'm going to say is that there are P wave bumps in there that can be identified, although that may be a little bit of wishful thinking on my part. So I'm going to say, and so the machine is actually identifying P waves, but it says the PR is incredibly long. So the machine is calling that a P wave and indicating that PRI is excessive, which makes first degree AV block. You look for the QRS, it's also more than 120. That's a left bundle branch pattern in there, which the machine picked up as well. And so we don't really need to do axis, but if we were doing axis, it would not be abnormal. It would be a normal axis. So this is not a bifascicular block. There are some conduction issues both in the AV node and in the bundle branches. And that's all I have to say about that one. Number 12. Rate's pretty nice and normal. Nice discernible P waves. It's good to see some P waves after those last couple. It's a regular rhythm. There's no drop beats, no extra beats. The PRI is okay. The QRS is okay. The QTC is okay. And so we finish up with a normal EKG on number 12.